Welcome to PNB Wellness Academy. Today we're reviewing Tegretol or Carbamazepine and focusing specifically on the high-yield concepts you need to recognize for your PMHNP boards. Carbamazepine has several important warnings and drug interactions that make it a favorite for board-style questions. We're going to break down its mechanism, major uses, serious adverse effects, monitoring, HLA genetic screening, enzyme induction, autoinduction, and one counseling point you'll definitely want to remember its effect on hormonal birth control. By the end, you should be able to quickly recognize the major carbamazepine clues in a clinical vignette. Tegretol is an anticonvulsant and mood stabilizer used in bipolar disorder, particularly for manic episodes. It is also used for seizure disorders and trigeminal neuralgia. A simple way to remember these major uses is CBZ, cranial nerve pain, bipolar disorder, and seizures. It primarily works by blocking voltage-gated sodium channels, which decreases repetitive neuronal firing. Although Tegretol can affect additional neurotransmitting systems, sodium channel blockade is the mechanism I would prioritize for PMHNP board preparation. One of the most important carbamazepine or Tegretol board concepts is the risk of severe cutaneous reactions like Stevens-Johnson syndrome and toxic epidermal necrolysis. The HLA B1502 allele is strongly associated with Tegretol-induced Stevens-Johnson syndrome and TEN, toxic epidermis necrolysis. The HLA B1502 allele is strongly associated with Tegretol-induced SJS or Stevens-Johnson syndrome and TEN, toxic epidermal necrolysis. Patients with ancestry from populations in which HLA B1502 may be present should be screened before starting Tegretol. So you want to remember in Asian patients, think genetically at-risk ancestry in HLA B1502. Another allele, HLA A3101, is associated with an increased risk of Tegretol hypersensitivity and reactions. Patient education about rash is critical. A patient taking Tegretol who develops a new or concerning rash, particularly one accompanied by blistering, mucosal lesions, fever, or systemic symptoms, requires prompt evaluation for potential serious cutaneous reaction. Another major warning is hematologic toxicity. Tegretol carries a black box warning for aplastic anemia and agranulocytosis. Remember, the CBC. Patients should always know to report symptoms that could indicate a serious hematologic problem such as fever, sore throat, unusual bruising, or signs of infection. Another high-yield adverse effect is SIADH with hyponatremia. Remember to monitor sodium, particularly in patients at increased risk. If a patient taking Tegretol develops confusion, weakness, headache, or other symptoms consistent with low sodium, consider Tegretol-induced hyponatremia. Other important monitoring includes liver function tests and assessment for neurological adverse effects. Common neurologic effects include dizziness, drowsiness, diplopia, and ataxia. These symptoms are also important because worsening neurologic findings can provide clues to elevated carbamazepine concentrations or toxicity in a drug interaction question. Now we get to one of the highest yield pharmacology concepts associated with carbamazepine or Tegretol. It is a strong hepatic enzyme inducer. An inducer increases enzyme activity and can speed up the metabolism of other medication, potentially lowering the concentration and decreasing the therapeutic effects. One of the most clinically important examples is hormonal contraception. Pregnancy counseling is also important. Carbamazepine is associated with fetal risk, including neural tube defects. So pregnancy planning and individualized risk-benefit counseling are important. This concept becomes particularly significant because Tegretol can also reduce the effectiveness of the patient's birth control. So if a patient is on birth control and they're also taking Tegretol and they rely on the birth control to be effective, we have to recognize the possibility of the contraceptive failure in unintended pregnancies. The patient should receive appropriate counseling about the need for secondary contraceptive methods, just in case their original method is compromised by enzyme induction, which would cause the birth control to be less effective. Tegretol also causes autoinduction, which means it induces enzymes involved in its own metabolism. After it is started, enzyme activity progressively increases, which can increase Tegretol clearance and shorten its half-life. Therefore, dosing and concentration may require reassessment during the early weeks of treatment. For the boards, remember general pharmacokinetic principle. Induction means faster metabolism and usually lower drug concentrations. You should also understand that reverse interaction. If another medication inhibits carbamazepine metabolism, concentrations can rise and increase the risk of toxicity. So you need to look for clues like diplopia, dizziness, ataxia, sedation, or nausea after another medication has been introduced, and you should make the consideration of a drug interaction with the Tegretol or carbamazepine. Whenever a question introduces or removes another medication, ask yourself, is this medication an inducer or an inhibitor? And what will happen to the drug concentration? Patients should not abruptly discontinue Tegretol, particularly when it is being used to control seizures, because abrupt withdrawal can precipitate seizures. For your rapid board review, you want to remember the major Tegretol associations. You want to remember the sodium channel blocker, bipolar mania, seizures, trigeminal neuralgia, Stevens-Johnson syndrome, toxic epidermal necrosis, and the HLA-B1502 allele. You also want to remember aplastic anemia, a granulocytosis, SIADH, and hyponatremia, hepatic enzyme induction, autoinduction, and decreased hormonal contraceptive effectiveness. So when you see carbamazepine on your PMHNP boards, remember CARB can crash and clash. Crash helps you remember the major safety concerns. C is for CBC. Carbamazepine can cause dangerously low blood cell counts. R is for rash. A serious rash can occur, so a new rash should always be taken seriously. A is for ancestry. Patients with certain Asian backgrounds may need genetic testing before starting carbamazepine because of the risk for a severe skin reaction. S is for sodium. Carbamazepine can cause low sodium levels. And H is for hepatic, to remind you to monitor liver functioning. Then think clash. Carbamazepine speeds up liver enzymes, which means it can lower the levels of medications. One of the biggest board points is birth control. Carbamazepine can make hormonal birth control less effective, increasing the risk for pregnancy, and it also has the risk for birth defects like neural tube defects. So remember, CARB can crash and clash. Check the blood cells, watch for rash, think about ancestry, monitor sodium level, and monitor the liver functioning. And remember, medication interaction, especially birth control. Those are the carbamazepine points you want to recognize on your PMHNP boards. And before we end, we want to talk about Tegretol's therapeutic serum level, which is between 4 and 12. Levels higher than 12 indicate toxicity. Toxicity may cause dizziness, double vision, and unsteady gait. So you want to make sure you're monitoring for toxicity as well. Thanks for studying with PMB Wellness Academy, where we make PMHNP board concepts easier to understand and easier to remember. Save this review, and I'll see you in the next one.